Today I'm going to demonstrate how to give an intradermal injection. The first thing that you want to do is remember the 6 rights of medication administration. So you want to make sure you have the right patient, the right medication, the right dose, the right route, it's the right time, and you do the right documentation when you are finished. So it is important before drawing up the medication that you do hand hygiene. Now I'm going to check for a doctor's order and check the MAR to make sure what I'm going to do and how much I'm going to give. So the order is to give Oscar Mayer a tuberculosis test. He'll take 0.1 milliliters of medication. After I've done that, it's time to drop the medication. So I'm going to go into medication cabinet, grab my vial, make sure that it is the same medication that the doctor ordered, and I'm going to check the vial for any type of particulate in the medication or any cracks or damage to the medication vial. This one looks good. Then I'm going to wipe off the top of the vial with an alcohol prep pad. I'm going to grab my syringe. For this type of injection, I'm going to use a 1 milliliter syringe, also called a tuberculin syringe, and a 27 gauge needle. The dose that was ordered for this test is 0.1 milliliters. So I am going to withdraw into my syringe 0.1 milliliters of air. Then I'm going to insert the needle into the top of the vial and inject my air. Then I'm going to flip it over to 90 degrees and withdraw 0.1 milliliters of medication. Now if I had any air bubbles in there, I would just stabilize and flick with my finger to get the air bubbles out. Okay, once I've authorized that I have 0.1 milliliters of medication in my syringe, I'm going to recap my syringe because I have to walk to the patient's room. So for that, I'm going to demonstrate for you the scoop technique. Hopefully you can see that. And I'm just going to scoop with one hand the cap onto the syringe, and then I can use the other hand to firmly push it down. Now this is helpful when you drop medication in a different room from your patient and you have to walk with your syringe to the patient's room. So that keeps you safe. If you can avoid it, avoid recapping needles, especially if they have been used. You want to make sure you have a sharps container next to you. If you absolutely do not, then you can do the scoop method, recap your needle, and then walk it to the sharps container to dispose of. So now that we know that we have the right amount of medication, it's the right medication, we are ready to go to the patient's room. So walk down the hall. Hi there, Mr. Meyer. I have an order from the doctor today to give you a tuberculosis test. I'm going to perform hand hygiene, put on a pair of gloves. Would you please state your name and date of birth for me? Thank you. So you check the name and date of birth with the patient's wristband to make sure that you have the right patient. Okay, Oscar, I have ordered to give you a TB test today, and that's just going to be a tiny little injection right under your skin to test for TB. The correct sites for an intradermal injection are the ventral surface of the arms, the upper chest, and the upper back. for this injection, we're going to pretend we're doing it on the ventral surface of the arm. So take an alcohol prep pad and clean the area, starting from the inside, going out, making a circular motion, and wait for that to dry. Okay. Now I'm going to uncap my needle, and using my non-dominant hand, hopefully you can see that. Okay, using my non-dominant hand, I'm going to apply pressure to the skin, just pulling it taut. I'm going to make sure that the bevel of my needle is facing up, and I am going to, hopefully you can see, I am going to insert it at a 5 to 15 degree angle. You should be able to see the syringe under the skin, just right under the skin. When the syringe is in place, then you slowly push the plunger, creating a bleb, and then remove your syringe and immediately throw it into your sharps container without recapping. You'll remove your gloves. Now, if you had a little bit of leakage, you can gently blot the moisture there. Gently, you don't want to rub it. You want to leave that bleb in place. And you're going to make a circle around the injection, about an inch around the injection site. That way, when you're going to check it at 15 minutes, and then when you come back to check it again, within, I think, 48 hours, you'll know if the area of redness has spread. Okay. So when I know my patient is comfortable and the procedure is finished, I'm going to go back to the MAR and document the medication that was given, the route it was given, the dose, and I'm also going to put that in my nursing notes. I hope you've enjoyed my demonstration on intradermal injections.